Tell everybody we're going live. Let's go live, guys. How's everybody doing? I think we have a bunch of people that are going to be taking their exam pretty soon. I had somebody call Aapc, and this is for the online exam. It's broken up into two parts, and these are what are in each part, according to the person she talked to on the phone. So I'm just passing along that information. And if y'all have not used a thesaurus to look up some AKA terms, you're really missing out. If you happen to look up the word incision, you will find the word cleavage, which is kind of interesting for an AKA term for incision. People are always asking me, how do I know if it's an open procedure or closed? Just do a thesaurus on some of these common terms, and you'll be surprised on what you find, for sure. But this is cool to know how the test is separated, for sure. I have a bunch of cool things to show you. I've tabbed them in the book with the little sticky notes for when we get a little few more people on. I will go over. Howdy, howdy. We're fixing to go over the CPC exam and how to prep for that if you want to become a medical coder and work from home. I specialize in Aapc CPC exam, the process of elimination, and helping you get through that test. It's a very challenging test. You have 120 seconds per question, and you need to be able to get that done very quickly. For reference, most people that are working in the medical coding field need to code 8 to 10 charts per hour, and the exam is 30 charts per hour. So you need to be really, really super fast, and you need to be able to get the information out of the exam question that you need quickly. You need to get fast at looking for your AKA terms or terms that you know are going to be descriptive words in your CPT book, so you can look those up quickly. You need to get good at being a word detective, spotting those fancy words that you need right away. Open, close procedure. Which artery are you in? If it's unilateral, bilateral. If you're going to have a technical component, all these fancy things that you need to know and be able to look at super quick to make things easier for you during the exam. The exam, if you take it online, is broken up into two parts. When you do get your grades back, you can see how you did in each section. If you take it online, you do have to email them and ask them for your breakdown. But usually you just get a pass or a fail online. If you take it in person, you'll get a grade that'll show up on your Aapc app that will show you the grade for each one of these sections. If anybody's interested into learning medical coding, I will show you how to prep your book so that you can find your answers super quick. We use all these white spaces to make sure we have the definitions down that we might need before each section. Each section is color-coded. So at the start of each section, just go on and write down your common vocabulary terms, prefixes, suffixes for that section. Hi, Belle. How's it going? Hi, Heather. Let me know in comments if you have any questions. Once you get done adding in your prefixes, suffixes, and your common definitions for a particular section, you need to do a reverse search of the pictures, the anatomy pictures, and draw in the sections that or items that they may have missed. Like they did not draw in the descending colon here. You need to be sure and mark that. Order everything in order. 1, 2, 3, 4, even if it's arteries, veins, how the blood comes into the heart and how it gets out of the heart. A lot of the exam questions for anatomy, AAPC has a history of picking orders of everything. What's the order of the digestive between the ileum, cecum, and duodenum? Would you know that? Which one's first, second, or third? Be sure to know those kinds of things. So I just go through and I number them 1, 2, 3, 4. That way I just have it and it's on one page where I know it's located and can find it super fast and easy. That's helpful. What I mean by a reverse search is I just take a picture of this, put it in Google Lens, and ask Google Lens to look for it. If you have an Apple, I'm not sure what you use in that situation, but hopefully it's just an app right there, Google Lens, and you just do a search and it finds it for you. Like that one, you can have it search and then it'll find me other examples of other people that have better notes than me, and then I can take their notes, add it to mine. Super fancy and easy. I love it. Why do they make the test so difficult? If once you start coding, you could specialize mostly. Yeah, I have the same question. The answers are there for you, so it's already coded for you. So you're not coding. That's number one. You need to sort of get out of that mindset that you're coding a chart, because you're not. You need to be able to identify things that would not go together, like a modifier with a ×2, or things that just don't look right, that you would never code together. They want to make sure that you've actually read some of the guidelines that happen before coding each section. Like on endoscopes, they'll say a few little words here about them, and then they'll give you the codes. And if you don't know what's in those little sections, that's where it really hurts you. Also, in the parenthetical notes that are right underneath the code that say do not code this code with any of these codes, they want to make sure you understand and know where these are, so they like to pick on this kind of stuff. It's made so that somebody that knows their book and knows their guidelines will be able to look through and go, the answer is A, B, C, or D, based off looking at the numbers numerically. I believe that's the way I take this exam. And this is how I looked at it and thought that's exactly how you need to do this exam, because you do not have time to code. You can't look through every one of those codes and get through the test. You need to have your book prepped so that you know exactly what is the key difference between one code and the code underneath it. There's usually one word differences that will make a difference between picking that code and the next code. perfect example is if you're in the 2021 CPT book. I'm on page 474, and these whole page is a list of nerves, and the test question will say we were working on a shoulder nerve doing this because this patient had pain. And if you don't have the nerve of the brachial plexus indicating that that is a shoulder, and if you don't know your anatomy well enough to know that that's where the shoulder is at, then you'll get that test question wrong, because basically you have to guess. They're not going to give you the medical term for it. They may give you a layman's term for it, and if you don't have those nerves, for every one of these nerves written as an AKA term, then you might not know the differences. There are several of them: intercostal, which is chest, ilioninguinal, inguinal, I'm thinking in the groin because we do hernias around in that area. But you really need to Google these and look, and then write the AKA term down right beside the code, and that'll help you. Hey Connor, how's it going? I was just discussing how normal medical coding you're expected to do between 8 and 10 charts an hour. The CPC exam expects you to do 30 an hour. You're given 150 questions in 5 hours and 40 minutes. You can get an extra hour for your exam if you get an ADA exemption. If you're taking it online, you can get 30 minutes per part added, and you can also get an ADA to be allowed to go to the restroom during part 1 or part 2 at home if you're taking it on at home, but you need an ADA to do that. They expect you, if you're doing it online, to be able to sit there for part 1 and part 2 without leaving your camera's viewpoint. But those are all things you can contact Aapc to find out about. It's a simple Word document written to them and then sent from your doctor, and then they'll send you a reply approving it, and then you'll give that reply to your proctor online when you're taking your exam. If you're doing it in person, you can get an extra hour, of course, and they don't care how often you go to the bathroom there. They just care when you're at home. But knowing the differences between these codes is super important, and I wanted to, and I had several of these examples sticky noted today. I wanted to show y'all. I know a lot of you know that in the back of the book we do have an appendix. Which one is that? Appendix, where they have all those examples in the back of how to code your E&M section. Which appendix is that, guys? Here it is, Appendix C. Appendix C is full of clinical examples. They're not very good examples because they're a little too easy, but they start out with 99221, and they give you 10 or so examples of how to code that one, what it would look like in a test question, and then they go all the way through. You've got a whole gamut of them for hospital admissions and things like that, so subsequent care, inpatient consultations. But did you know that also in your other sections they give you actual clinical examples in each section? So just for an example, in the integumentary system, if you're in the 2021 book for CPT, you go to page 91. At the top of the second column here, it'll say, for example, if you have a patient who has 4 square centimeters ulcer and then 10 square ulcer on the neck or wherever, and then they have a subcutaneous tissue debridement that you're going to do and some other work. How would you code those? And they tell you how to code them. They have several examples of how you would code certain things that they've written out for you. And if you search the book, you'll find quite a few. I've got a couple of more right off the bat on page 107 for adjacent tissue when they're talking about moving healthy tissue to a bad tissue area and how you would code that. It'll say, for example, if you have this size wound on this particular part, they move it from here to here, how would you code it? Here's another example, and here's another example. So the first paragraph has two. The third paragraph has one right here. They do give you some clinical examples. You just have to hunt for those. So I wanted to make sure that you knew about these, and you can move these examples, which are in this, is not very helpful. Move them to the codes. This one is talking about the 1500-02 code. So that's not even on this page. It's over here on your next page and starts right here. So whatever that example says, I would move it to here underneath the code so that you have it next to the code. And then that way, you know how I have at least 2 examples on every page. But if I didn't include that one, then I would add it in whatever space I could find, for sure. The top of this next page has another example right here of how to code the 15273, which is a couple of pages away, but still, you could move that to the actual code so that it's where it needs to be, so you have it. But I have some more. Gosh, I got sticky notes everywhere. We've got 103, page 103, and I put stars by them so I could find them fast for you guys, but we've got another one to add some more extensive procedures to something. They'll give you an example right here. So, just love it. I thought that was great info. They have them in every section. We can go to muscular skeleton, and I've got on 152 is just full of them. We've got one here, one here, one here, and one here. They're pretty good examples for how to code certain things. This one's even got patient age, 42-year-old male who has a history of post-traumatic degenerative disc disease and where it's at and what's going on. So then you can just take the codes that they used for this particular procedure and move that example to it. So it's 2258. So you just have to go find your 2258 and then go write it underneath it, because that would make this whole book a lot simpler if they just put the examples with the freaking codes. What else have I got back here? I had a few in lab and path, and I know this is a very difficult section to do. 590 under drug class, maybe they have, for example, when they're doing an analysis of amphetamines, they have one right there that is usually on the exam for sure. And then on 592, we've got one right here too. I think for 2022, I could make a list of where all these are at and have that as one PDF page so to help y'all find them. Some of them are not marked very easily. Some of them are hidden in the middle of freaking paragraphs, and it's not easy to find. I have these books in PDF form where I can do a Control F and search each section and look for the word example over and over again, which will help me find these examples. But if you only have the paper book and you have to read, it would be impossible to find some of these, all of them. So, and very time consuming. So once I finish my 2022 sections, And then I work on our AKA list. And then I work on my bisection practice exam questions. Then the next thing will be in line is to tell you where all these examples are in the books so that y'all can find them, I think. Let me check some messages here, see what everybody's been writing or asking while I'm showing you part of the book. Let's see, how's everybody doing? You take it Saturday? Oh my gosh. Okay. Do you know if I can use the 2021 books if I take the test in January 2022? Hey, schwank.com. Schwank.com. Cool name. I don't work for Aapc. I am a guest educator for them. But if there's any indication, I don't think they update things as far as January 1st, it's a new exam. They say they do. If you Google it, it comes up on their website saying they changed the exam on January 1st. But they don't even sell 2022 education material or courses. They do sell them a little bit beforehand, but you can't access them till January 1st. So and then if you bought any of their practice exam quizzes recently, those quizzes, A, B, C, D, E, and F, have not changed since 2019. Their study guides haven't changed since 2019. They might delete a code or something, but the words and the questions in the back chapters are all the same. They do very little update and are slow about it. So everybody assumes that the quizzes or their exams don't change till March, but I'm not part of their company. I don't represent them, and I don't know how their policies and procedures go, and they may end up getting new people in, and the next year may not be like the last year's, and they might start January 1, boom, with a new test, and I don't know who their administration is or what's going on company-wide. I have no idea. So by history, I don't think they ever have till March or April switch the exam, but I don't want to be responsible for you not getting a good grade because I told you could use your old books. Now, you can use 2021 books for the entire year of 2022 exams. They don't care what you bring in, as long as it's not 2020 books for 2022 year test. But you can bring the previous books all year long if you want to, just as far as nobody kicking you out, and you can have those books. I took my exam with 2018 books in 2019. I wasn't going to buy any new books because I didn't really care if I passed or failed. I only took it because I had downtime at work. And during COVID and all that stuff, I decided to just go on and get it done since we had shut down a lot of our audits. And I had time on my hands, and this was just going to be a conversation stopper because a lot of times they ask me, am I a CPC? Because I do deal in numbers all the time, even though I'm not a coder. I don't want to be a coder. I do not like coding. I am a medical auditor, but I get asked all the time, so it was just to get people to be quiet. Yes, I am, and then they'll shut up. And so I don't have to tell them who I am and why I do what I do, and no, I'm not that. But anyway, so that's my spiel on that. Use your best judgment, but you can use your 2021 books all year long. Now, whether you're going to get all your answers right based off that book, I don't know. You can always take the 2022 updates and write them into your book. You can delete codes by drawing a line through it. You can write in the new codes. I even have in my 2021 book, especially in E&M, because some of the exams had not changed, but we had the new book. Remember in 2020, we had 99201, right? And we had 99211 or something like that. But I wrote them in because part of the year for my notes, y'all needed that information. And I didn't have it in this book when I started feeding the notes out to people. So I just wrote in previous year's info. So you can do the same thing and then not update your book since you've already done all this work anyway. Okay. Why do they make it so difficult? Yeah, I know. The exam is unrealistic. You know, even an RN, a registered nurse, has 75 questions, no time limit. We have 150, and we need to know everything that a physician or a surgeon, a neurosurgeon, we need to know everything he's doing in the neurosurgery, which route he's going, which exit he's doing, how he opens, closures, what procedure he uses, what tools he uses, what the name of the procedure he's doing or she's doing. We need to know how they do that procedure from one end to the other. And yeah, we don't get paid or given an exam that is as easy as an RN that would be in the surgery with him, help and assist. So in a lot of ways, we know more than the registered nurse would about the procedure than what anybody in there knows anyway. So don't get me started about this exam. I don't think it's a true example of if you are a good coder or not at all. This is just if you can pick out the right answer super fast. Okay, on the job is where you're expected to drop the charge every 3 minutes. Wow. I can hope this helps me in time. Wow. Every 3 minutes, a whole charge. Well, I could see that if you're routine and it's the same procedures, your doctors are doing the same thing every day. But if you are doing multiple encounters through a hospital for multiple providers or multiple specialties, I could never see doing 3 minutes. That would be insane. Between the labs and the op reports, and yeah, that would be crazy. But specialties, once you get used to it, you can get pretty fast for sure. At my practice, if we have any paper claims from physicians, we just scan those and send those to some company that probably mines it out to somebody else overseas who just keys in the data, puts it in a format that we can pump it back into our EHR, and it'd be an electronic claim. We don't have very many, maybe 5% of physicians that still do paper claims, if that. But most EHRs are just click, 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 and they're already submitted, and they're already, a 99213 or whatever the doctor fixed, and you just evaluate to make sure that they picked the right check button because it's already picked. Did they pick the right vaccine? Did they pick the right glucose test for in the office, in person kind of glucose test? You're just kind of a babysitter, so 3 minutes is still fast, but yeah, I could see that. How often do you live sessions? I need all the help I can get. In Chapter 7 with Aapc, yeah, their course is unhelpful for passing your CPC exam. So my advice is go straight to the quizzes. There is usually a list of answers for the quizzes in your top left corner where it says course material. Look in there, look down through the bottom, and it'll say it's a PDF or 2 PDFs, and you download those, and it'll have your quick 10-question chapter exam answers listed there. Go on and answer those really quick. Skip all the anatomy and all the other crap. Videos that are repetitive and drive you nuts. Go straight to your review exam. and take it, and then write down the questions in one color, your answer in the other color. Once you get your result back and you see whether you did it right or wrong, write the right answer in the other color, question in this color, write all the questions and answers down, because when you take it the second time, you got to make a 70, right? They're going to recycle those questions and they're going to put them in out of order. Then you have got a reference page of all the questions and answers you just did. But since they're going to give you the exam again, if you didn't pass, they'll be out of order. Then that way you can find them quickly. And if they're in two different colors, it's easier to find. They are going to give you some updated questions. Maybe 10%, 20% of the questions will be new ones that you haven't seen before. Google them if you need to. Find the answer. And then that way you can make 70% for all your review exams at the end of every chapter. If there are those long clinicals where you have 5 things to review, this whole surgery thing, and you got to put in like 3 diagnoses and 4 CPT codes with modifiers and crap, Google the first sentence in those. All of them are on Quizlets with the answers. Already somebody's taken that course and posted them there for you. You can write down those examples in your book when you find them and you get the answer right. Go to those CPT codes, write down your little scenario like I have done right here with the ICD-10s, with the CPT codes, even in your CPT book. Then you can also go to your ICD-10 book. What book is this? That's 2020. I think I'll have that in it. You can go to your ICD-10 book and you can go on and write down all your little examples that you had in your exam, even the review or the long notes that you have to do. But this is going to speed up your course to make it a lot easier for you to get through. Then you need to add the data to your ICD-10, in your CPT, or your hit picks. Just write a little scenario about what's going on in the question. Write down the answers in the way it's supposed to be written out in the proper sequence. You'll get this as you go along, but writing down all your exam and review questions and answers in the books will give you a whole course reference to reference during your exam that you're taking. But don't try to memorize everything they're teaching you in that course. What is going to help you is getting examples in this book, fixing your out-of-sequence codes, writing down the differences between that CPT code and this CPT code. This is with a port. This is without a port. And then having those examples, 2 per page at least, of what's going on and how you would code that particular CPT code if it was an exam question or something. But if you linger in that course and watch every video and take notes, you are going to give yourself brain fatigue. You're going to not retain any of it anyway. And none of it is helpful for your exam except for the practice questions, scenarios, and getting those down in your books for sure. That's the only thing that's helpful. And if they call something in a particular question, like this 58-year-old man who went on and had a heart bypass with a graft, and he was put on a cell saver at the time, figuring out that they meant that is a pump oxygenator, which is also a heart-lung bypass machine. That is more helpful than anything else, because the next time you see that question, they are going to say it's a cell saver, and if you don't know that's the same thing as a pump generator or a heart-lung bypass machine, then you won't know to pick that code versus that code. So having that kind of stuff written in a little scenario is super helpful during your exam. You're going to have 120 seconds per question, and that's if you can get into your exam booklet immediately. You have no potty breaks, and you sit there and do every exam question instantly. Time is going to be the biggest killer, so being able to get the information written beside the CPT codes is going to make the difference for sure. Having your AKAs written down, knowing that this one is posterior trunk means your back, knowing that the anterior trunk means your chest, knowing what the name of certain tests are called, because they call this a reconstructive procedures of the breast. Well, that's not how they're going to word it in the CPC exam question. They're going to call it a tram flap. And unless you know that a reconstruction procedures on the breast is AKA tram flap, then you won't know which one of these to pick during your exam. So paying attention to their practice exam questions is super helpful, and getting those, just go to the CPT codes used as the answer, write the little scenario down, and say it's that example. Super helpful. The codes that do not have examples written beside them, or they were not part of your course, then you just need to go through and see what the differences are. So if we're looking at two codes, let's see if I can't find something right up here at the top. We've got two anesthesias, 2-4. One of them's for cardiac, one of them's for trach. So this is trach, is what we should write right up underneath here. This is going to save you time. You'll see I've got a bunch of questions we can go over in just a minute, and this is cardio. When you are given a question, you're given A, B, C, or D, and it may be between this code and that code. And if it is, then you've got to get to the number, and then you've got to read into the description to find out what the two differences are. If you go on and take that difference and write it right underneath the number, then you've got it. You'll know that you're between the two numbers. I'm looking for the keyword trach or cardio. I'll go to my test question. If it says we're doing cardio, then I know the answer is 3-7. Boom, I'm done. Move on to the next test question. If it's about a trach, bronchial something, then I know right away it's going to be the 3-9, and that's my answer. Move on to the next test question. That is going to make you pass or fail right there. That's going to help out so much, is to get those differences written underneath the codes. And then doing some examples on some of the tricky stuff, like integumentary has a lot of multiple things that you could have to do, like you might have to do a basal carcinoma on the shoulder, then 5 skin tags. What do you code first, and in what order? So, and what modifiers, if any, would you need? So writing those examples when you know there's going to be multiple procedures is super helpful. Integumentary is a big one, and so is lab and path, where you do multiple CPT codes on one patient for one visit on one day. So that's where your guidelines come in. You need to make sure that you know that the bigger the item is that they remove needs to go first. You might have only had one thing that you removed on that left shoulder, but because it was a basal cell cancer cell that you removed, that's a bigger deal than any kind of skin tags. You could have had 50 skin tags. It might have taken longer to do those skin tags than it did to take that little thing off the shoulder, but because of what it is and the importance of it, then that needs to go first versus the skin tags. So knowing that kind of stuff is super helpful. That's where writing these examples that they do give you down next to the codes is super helpful. And then also, if you're in a course, go on and write every one of your chapter quizzes, questions and answers. Don't write them word for word, but paraphrase whatever was going on in the scenario and then write out the codes in the correct order form. Best advice right there. Just go on and skip your freaking videos if you've seen them 9,000 times, because they get super repetitive with that anatomy stuff, and just go on straight to your quizzes. Try to find the answer sheet, the cheat sheet for those little small 5-question chapter pause marks. And then I wouldn't even download the PDF for the chapter. I would just go straight to the exams, all the exams, anything you got to fill out and get a grade on, go on and do those. And then write down the proper answers and questions when they give them to you, so that you know when you do the retake what the right answer is. Then you've got that whole book of all the correct answers, and the wrong answers aren't in there, so they're all the correct ones is what you wrote. For your final exam, they will not give you a grade on it. They're just going to give you an exam, and you won't know which questions and answers you did. But if you've got it all listed in your notebook of all the questions and answers from the first chapter all the way to the end, you'll have a reference material to take the final exam, which will help. And if you type it out in a PDF and then you can do a Control F to find the stuff, that's even better. But I wrote out all mine, so I don't know. That's just the way I did mine. You take yours, Chell, Miss Howard on Saturday. Binky, awesome. You're taking yours on March 22. How helpful do you think online exam through Aapc? Do you mean taking your certification online, or do you mean taking or buying those practice exam questions online? Miss Dinky. Let me know which ones. If you're talking about the practice exams, they're like $400. They haven't updated since 2019, but they are helpful in a way. They're going to ask you questions like, what is PHI? And then they'll give you a list A, B, C, or D. But in the real exam, it'll be a little bit more difficult. It'll be more like, which one of these is a PHI violation? And then you read these A, B, C, or D little list of things, and then you got to pick out which one it is. So you're really not prepared for that type of question when you're used to a what is PHI, and then you're just looking for a definition. But when you get down to the real exam, they're showing you examples of good and bad things, and you got to pick it out. So it's different. It's different, but it's the same. You know, it's a little bit more. I think the questions are there to shock and awe you and make you think, oh crap, I don't know, and that's what they want you to be. So let's see. I have bought them all, and they are so helpful. Definitely worth the money. Good. I'm glad you think so. Perfect. I hope you do really well. And I had the practice exams in my bundle too, so I use them. It's just neat that people will share their current ones with me, and we're in 2021, and they're the same freaking questions and answers. So I feel bad everybody's paying all that money for them, but yeah, I need to make up my own set of exam practice questions, and because I could do a better job of referencing what type of questions we need answered. A whole lot easier. Let's see, Miss Irene. She failed her exam by 2 points. That is very, very, very common. And I have questions on how you find med terms. Okay? Irene, don't forget on med terms, your ICD-10. Before you code every section, there's usually an anatomy page right before. It'll go on a cellular level, show you how they make up that body part, tell you all the parts and how they work and what their function is, and then it'll go through the disease process. And this is where I find Aapc does a lot of their words. I mean, they'll go find stuff in the middle of a sentence that's so obscure and barely mentioned. Barely. and it's listed here. I've also been collecting a list of the vocabulary for the last 45 days of the ones that are on the CPC exam currently. I have that posted up in the store, but I also give out that information during our exam or our lives too. So let me bring up something real quick. Again, this is what somebody said. If you're taking the test online, this is how the two online exams are separated and what goes into which exam, in case you want to screenshot that. And then, let's see, where is something else? Here we go. So, if you want to schedule tutoring with me, it's $26.99. It's scheduled through my website, Medical Coding by Jen. I have it open for Tuesdays, Saturdays, and Sundays. I had to close Thursdays because I have doctor's appointments for the next 2 weeks after this coming up for the hand. I got to drive an hour there and an hour back, and kids, it's just crazy. But tutoring is open there right now if y'all are fixing to come up with your exams. Repeat lives go on YouTube if it's recorded, but so far I know that TikTok is not recording anybody's lives right now. Don't know why. It's just not happening. But I do these Monday, Wednesdays, and Fridays. I've been asked to do it again on Sunday, so I'm going to try my best. But every Monday, Wednesday, Friday, I do 2 hours of free education here on TikTok. I wish they would record, but they have not been recording since November 14th, and I'm pretty devastated about that because a lot of it's really cool information. And then copies of my notes are here on Etsy. There are lots of anatomy that is new that we've been going over. It's so cool too. But some of the most common stuff is things like the sesamoid bone. Be sure you know where that is. And in the foot, they have the big foot. I have a list of the top 10 guidelines that are on our exam. That's listed on our at the bottom of my new updates for the 2022 guidelines, which I did, which is really cool. I took the 2022 CPT codes. I have E&M done where I took the code, told you exactly where to go, what to highlight, expanded, straightforward, how much time and stuff. But then I put the coding examples right beside each code on both sides so you'd know how to code each one of these. But at the end of this E&M, I have a list of the top 10 right here. And then when I did the ICD10 Guidelines, I have a list at the bottom of there too. And then I also have a modifier list and what is included or asked in each exam chapter. So if you're in musculoskeletal, what are they going to look at? That's the end of this particular thing that's on Etsy. So what kind of questions are they asking in cardiovascular? What part of that chapter do I need to know? That's at the bottom of this too. So super helpful information. I wished I had it when I was going in. Some more definitions they're looking at is NCCI. Be sure you know what that is. How to code possible pneumonia or to rule it out. Super helpful. What is in Part A, Part B, Part C, or Part D of Medicare? If you were having an impending or fixing to have a heart attack, what would you code? It's an ischemic code. What is a venous valve? That's not part of the heart. It's part of your muscles that helps you move in and out. Here's another definition they're looking at in the last 45 days. This one was given to me this week by somebody I was mentoring. They said another word for incision could be cleavage. And I went and checked the thesaurus, and she's right. And I'm like, oh, that's great. And it's right there. As soon as you bring up incision, you see it. So they might say, if you need to know if a procedure is open or closed, you got to look for all kinds of weird, fancy words. If they're looking for scalpel was used, or cleavage. If they cleaved the skin out of the way, they used a scalpel, and they used an open procedure. So I love that one. Be sure you know how to code sepsis. There's several different ways on that one. You need to know if there's organ damage, organ dysfunction, or none involvement at all. And then there's several ways to code sepsis. Sometimes it's one code first, sometimes it's another code second. So be sure you know that. On your exam, some more definitions. As soon as I can get my mouse to work. There we go. We've got that's septic shock. And then I put some examples of how you would code if they had pneumonia with respiratory failure. Sepsis would be your third one. Then your acute renal failure. And then severe sepsis and shock is your last one. The other day I was working with somebody going through some practice exam questions, and an R code came up as their first diagnosis code. And then their other option, like option B, did not have an R code. It had a C code, I think. And they were all running to the ICD10 book, and I'm like, think about this. Would an R code be your first and only diagnosis normally in any kind of patient scenario? What is the R section in the ICD-10 book? It's symptoms. Symptoms are usually, unless that's all you got, you're not supposed to code them. So think about those kind of things as we're going through these practice exam questions. You know a lot of this information, but you're so focused on coding because you want to be a good coder that you're trying to run to all the codes without thinking about what the codes are before you run to them. So don't forget about that. That's all sepsis. I did a bunch of those in sepsis. Be sure you know what an ABN is. The phalanx code is one of our definitions. How to code multiple pregnancies. It's always on there. The knee is divided into 3 parts, and so is your shoulder. That is divided into 3 parts. Be sure you know how to code metastasides. There's also a difference between anemia due to cancer or anemia due to the treatment of cancer. You'll flip those codes around. It won't be one position and then another way. It'll be another position. Be sure you know these. HIPPIX code S0131 was on there. And where is my live from right here? Because I had some new updated stuff that was just on this weekend's exams. Service code 14, don't forget that's the very first page in your CPT book. Know where service codes are located. If you're having a brain fart and you absolutely get shocked by a question and you don't know where to look for the answer, that was intentional. So don't worry about it. Think, you're not going to play me, and either just pick an answer and move on. It doesn't matter. Or write down the number of the question and go back to it later at the end. I guarantee you'll be able to find it or know where it is later on as you're doing the exam. You'll get into your pattern, your routine. You'll start remembering where things are at. But usually those first questions are shock and awe. I've never seen this before. I don't know where it is. Oh my God, I'm going to fail questions. So don't let them play you mentally. Just skip it and move on. Don't let it play you. Just start. Even if you have to skip the first 3 questions, don't stress. Don't worry about it. Just start where you see one that you know where the answer is, and then start your pattern there and keep going and keep going. You can go back to those other ones later. I had somebody, deer in headlights, service code. I know where that is, but I don't know where that is, And she just stood there like, and couldn't move because she knew it, but she didn't know where it was at that particular second. So don't let them do that to you. Be sure you know what medical necessity is, why we need it, what parts of it are needed, and what does the final outcome need to be. So we need to lead to some goals. Be sure you know a lot about the eye, like the abbreviation DACRY is all to do with the tear duct, lacrimal gland. Be sure you know that. The metastatum, yep, we're talking about the chest cavity. The 3 layers of the eye, or the last layer of the eye. I haven't figured out what that question means, but the eye is divided into 3 layers. The cornea and sclera is in one. The uval tract, it contains the iris, this one and that one, bodies. And then the retina is the last one because it's in the back of the eye and it actually takes the image and turns it into something the brain can understand. So, and then there's a question about what is the last layer of the eye. Are they talking about these layers or are they talking about the eyeball itself? Hold on, my children need me. Yes. You, no. What did you eat? Oh, never mind. Come here. What did you eat meat-wise? See, you've already had mandarin oranges. And you gonna grab another can of mandarin oranges? Meat. Protein. I got a fruitaholic who just wants to eat something sweet and sugary all damn day long. So, yeah. Gotta eat some meat. Let me check out these messages while I'm stopping here. That's a great hack. Thank you, Sean. Or Swan. I did terrible on the lab and path. Any tips? Yes, and I'm doing lab and path Q&A questions all night tonight. So as soon as I get to that part, we're going to do like 15 lab and path questions, practice exams. Can we get the 2022 books now? Yep, I've already got mine. I'm already updating them and publishing my notes for those sections right now. The only one that is not available is HitPix. AKA list would be awesome. I know, Bells. I'm working on it. I really am. Let's see, Dink. Oh, thanks for the roses. I will be using that information, or the money, I guess, for people that want free notes. So that goes over here into like a balance of some sort. And right here. And that's what we've got so far. Looky there. And I can, I don't know, withdraw that at some point. I've never done that before. But let's see. Where is the other thing where it says, I don't know how to, ain't never done that before, but they were always updating this damn thing. But used to be I could click on a thing that would show that nothing's been withdrawn before. But I haven't even added a withdrawal method yet, but I will eventually. But we get enough to where we can donate somebody some notes that needs them, that is struggling financially. We'll do that, absolutely. And the notes, the money for the information that was on the exam for the last 45 days, the proceeds from this particular sale is definitely going to that too, for somebody to be gifted some notes that's struggling. Ambulance service, A0427, it's a level 1 ambulance. Time reporting for anesthesia. And the distal end of your wrist, or the wrist joint, is distal to an elbow, was just on somebody's exam this week. So I added some more stuff, like your eyes are lateral to your nose is medial to your ears, things that can drive you nuts, that in the middle of a stressful situation, it just seems really difficult to answer at that particular time, because it's not a normal way of thinking, you know. The scaphoid lies proximal row of the carpal bones. The knee joint is proximal to the ankle joint. It's just weird, obscure anomalies that we should know, yeah, but we don't use it every day, so it's very hard to just bring that up out of the brain unless you're really smart about all that stuff. So I have these written down. 0102T is in the back of your book near your Category 2 codes, which are not sectioned off like they should be. They're all in one color. Numbers do re-rotate, so when you start looking through this and think you can't find 0102, just keep going. Keep turning pages, because eventually the numbers will reduce back down, start over again, and you'll eventually find it. It's not the first part of the Category 2s. It's in the middle somewhere, so don't give up. But this is electrical shock for your elbow. In case you have nerve damage, they'll electrical shock it, and you can get your grips back and help with pain, apparently. So that was some of the new stuff that was on their exams this weekend. Let me continue on with some of these questions that y'all have got in here. I called and asked those questions today, and they told me you can use the year and the year before. Yep, you sure can, Ange. Perfect. And I can't afford a new book right now anyway. Yeah, don't worry. You can use your 2021 books all year long to take your exam. And they do publish the changes. And you can go in and just write in the codes that got added, right? And then X out the ones that got deleted. You can make this into a 2022 book. That's what I did for this one. I took it and made it a 2020 combo with 2021 book by writing in my stuff. So you can do the same thing. Absolutely. No reason to buy new books. Don't send them more money. I just made so many notes. Subtly worried that I might need new books. Don't worry about that. Make your rainbows. Like I said, make your rainbows. Don't worry about what nobody else says. Just don't have any big, long, open paragraphs, but something equals something else. Short notes about even their own questions and answers are just fine. Write whatever you want to write in your books. Make them rainbows. It don't matter. It's yours. That's just a bad example, but yeah, you know, this is more like it, right? 10 minutes after trying to study. Yeah, yeah. Just make them yours for sure. Hopefully nobody will mind, but I have some that, I was trying to find the one where 3 questions were answered for that one exam. It's the GI one, but this is a really good one. This one was shared with me today. I hope she doesn't mind me sharing this. This is cool. I forgot to ask. But notes are notes, man. Put them in there. It's fine. It's your book. You write your notes. Just be sure you know where they are. Don't write what is OPI in the middle of neurology or something. You know, keep your guidelines or your laws and legislation in the front of your book before your E&M. Keep it all organized. Keep your heart stuff with your heart, your musculoskeletal with your musculoskeletal. Keep it where you can find it. And don't bother putting anything in your ICD-10 book, because I did, and then I forgot all about it because I was in the CPT for over 100 questions. I forgot that I had so much stuff written in my ICD-10 book that I just, you might refer to it 5 times during your exam because you don't have time for anything else. But I had so much stuff written in my ICD-10, but I forgot all about it, and I could have used it, especially that picture. But yeah, I had so much in my ICD-10, but I didn't have time to, and forgot that it was all there anyway. So I just used my CPT book, but yeah, don't put it in a bunch of other books. Be sure you know what things, their definitions are, and you might think it's kind of silly, but what's the definition of HCPCS? What does that mean? What is HCPCS? I might even ask you something like this, and I just wrote it on the cover. Healthcare Common Procedure Coding System. Something simple like that. Be sure you know exactly what certain abbreviations mean. Super helpful. And then when did HCPCS start? Why? That's on page 7 if you're in 2021 book. Second column, third sentence, it's the Balanced Budget Act of 1999. Just things like that. We've got one in our CPT book too that lists the codes, when the new ones come out and when they start. That was on one of their questions for guidelines and stuff. So let's see. I have 2 allergists and 7 endocrines and 4 diabetic educators. That is fun coding right there. Can you give me tips on finding medical terms? Was on my weak areas where I made a 68. Following me, getting the updated list of what was on people's recent exams for anatomy is by far the most helpful I've seen. I have them published on Etsy, and then I go over them in the lives. So writing that anatomy terms that I gave out is by far the best, because they could pick anything out of these books for anatomy. But knowing what was recently on their exams is super helpful. I even had them listed out in exam A, B, C, or online. So that's super helpful. Just don't forget about your ICD-10 book before you code a particular section. There's a ton of anatomy in there. You can find it there. One of the codes was, or one of the vocabulary words I had was a S-K-E-N-E gland. It's a lesser gland of the female reproductive organ system. It is in the ICD-10 book in the female reproductive section, but man, that was hard to find in the middle of an exam when you only have 100 seconds. So it's best to know what we know here for sure for that. As far as tips and learning stuff, you couldn't learn enough. You really couldn't. The anatomy, there's so much to know. There's so many tiny little parts that they think of picking. They're even picking this thing that's called an OS. You think OS means I because there is an OS, an OU, and an O something else for the eyes. But this happens to be the opening of the cervix and the opening of the vagina. And there's a cervical OS and a cervical, and a vaginal OS or something. But they are just picking things that they know could lead you to another route. Like those venous valves, you think it's a heart valve because it says valves, but that's actually the joints that let you extend and contract your muscles in your joints. They pick words that they know that are going to be tricky and to lead you into another area. So I find it best just to collect all the information. If you take your exam and you share that information with me, what vocabulary was on there, I'll share it with everybody else. It can make a huge difference in somebody else's lives and get them that 2 points they need to get to the 70 is the best way I know how to figure out what anatomy is on their test. I'm debating to go to school for Aapc and CPC. Oh, I wouldn't buy a course unless you've got the money and the time to spare on it, and you don't need to rush and you don't need the income. What I would do is buy a package to take the test twice from Aapc because you can take it twice. And companies are not picky whether you have a CCA or a CC or CPC, so it doesn't matter. I would get the study guide in your package, which is a nice, great little notebook that has more than enough anatomy in it that could drive you insane. Practice questions and everything you need to know about coding is all listed in their study guide. It's their workbook thing. I'm trying to lay my fingers on it. And even if you get an old one from like 2019 off of McCary or some other website for $5 and shipping free, then even better. That study guide is super helpful. Transfer the information from the study guide into this book. Find you some practice exam questions. Move all their own examples from the book that show you how to code either from example Appendix C or in each one of these that say, for example, code this with that, to the codes, and learn from my notes or from my lives or from my YouTube videos that show you how to prep this book and learn the process of elimination for the test exam questions, and you will be just fine without taking a course. That course is going to leave you dissatisfied with spending your money. I've met one person so far, one, who has said it was a great help and they loved it. Most people come out of it more confused and stressed, a lot of stressed, because they don't feel that they know anything after they got out of it, because they paused in the middle of it because it's repetitive, and then they had to cram the last part of it in, and it was just rough on them. It was very, very rough. And I was given their COC, CPB, CIC, and their medical documentation courses for free. And I'm so glad I didn't need to learn from those courses to be able to get those certificates, because I would not have been able to if that's all I had. I'm here to tell you, for sure. All right. Yep, skip the anatomy and med terms for sure. Those videos, oh, they're awful. Do you currently have a list of AKAs? I do not have a list of AKAs yet. I do have AKAs listed in my notes beside the CPT codes where it matters, but I don't have a one-pager all AKAs. Thanks, Cashley, for the rose. You take yours next Saturday. Ellie, that's awesome. I don't know if your last name is Scott, but one of my best friends from school, her name was Jennifer Scott. And I probably haven't seen her since she was like 9 or 10, but she was great. She could vomit on command, and that was the best thing to have in kindergarten. Man, it was great. We could get out of so many assignments. Love her. I miss seeing her. I hope she's doing okay. Bells. Nicely. Show it again. Cashley, what did you need me to show again? I'll be here Monday, Wednesday, and Fridays. Yay. Elsa. E&M. Yeah, it's super good. And the ICD10 Guidelines, I actually take the guideline, show you a print screen of what that guideline is pointing to in the book. So because it's like vague, right? Those ICD-10 guidelines in the book, the 33 pages, because it's like, I don't know, it's Greek. But I took a screenshot of exactly what it's pointing to in the book or telling you about, so you know what it looks like in the book when you get there. And then I do the coding scenario. I have an example there that shows you, okay, you'll code it this way, and you'll sequence it this way when you see this scenario that they're talking about in this guideline, that the page is divided into two. The guidelines are all over here. Then I have the screenshots of what it looks like in the ICD-10 book actually, and then coding examples right beside it. So I took those 33 pages and turned it into 150 something. I don't know. But yeah, it's super cool. It'll be worth a career. It'll stick with you for a long time. Those guidelines don't change very often, and they've been around since 1995. So it's really good and helpful. I chose fruit, no protein. Well, that's how Steve Jobs died, right? The Apple guy, he was a fruitarian. Didn't he die of kidney disease because of that? So I worry. Got to give him some protein. He's a sugar maniac. Let's see. That is nice of you. Do you have this updated on Etsy list? These, from my live on Monday, these medical terms of the new list is not on Etsy's page right now. I will update them when I get off this live and add these to that list so that it is updated, and I'll post it on Etsy saying it's updated. It'll be in the bio that'll say it's been updated as of today. All right. What about the practice exams on AAPC? Worth it? I don't know how to answer that. I just know they haven't been updated. Practice exam questions are helpful to do. They really are, but $400 for something that hasn't been updated since 2019, I think is a sham. I really am not happy with AAPC to be charging that much money for one thing for thousands of people that hasn't been updated. It is helpful, I think, to do the practice exams. And that's where I get a lot of my questions from. I buy them just so I can share them with you so that